Hello everyone, it's Dr. Bob Brown. I'm recording a second version because it seemed the one from last week was really helpful to a lot of folks, and of course things are changing almost on an hourly basis. So public health addicts like me are following the Johns Hopkins site to see what's happening across the world, and this is kind of a good way to see what's happening. For a while we were worried, how contagious was this and how severe is it? Unfortunately, the how contagious is turns out to be very contagious, so it's pretty obvious to anybody here that it's very contagious. The real question at this point is how bad is it going to be and what's the case fatality rate? The challenge is the numbers are all over the map, and that could be kind of confusing. If you look at the case fatality rate, it's anywhere from 0.2% to 6.7%. Well, why is this data all over the map? And the problem is, of course, sometimes the data is bad. And the reason the data is bad is because a lack of adequate screening and getting everybody tested, mainly just because it's hard to do. The Chinese can't be faulted because it started there. They had to figure it out as they were going on. The rest of us had time to prepare, and some prepared and some didn't. Germany is probably one of the best examples of being prepared and doing all the screening. And so the numbers being all over the map is partly what I would call a denominator problem. And so essentially, we know what the deaths are. Those are pretty hard to miss. It's either dead, not dead, and not a lot of gray area there. But we have identified cases, but we don't know how many of the unidentified cases they are. So if we use worldwide data, we're at a case fatality rate of 3.7%. However, that's much higher than probably the real case fatality rate we don't know because we don't know how many unidentified cases there are. And so if we did know that, we'd have an actual number, but we of course unfortunately don't have that. And we'll never have the perfect number, but we can get closer. So again, if you look at this, the numbers are all over the map. I think one area can tell you that if done correctly, the South Koreans and the Germans probably have the better data. So if we look just specifically at Germany and South Korea, at their data, the case fatality isn't 0.7% or 3.7%, it's closer to 0.7. And even there's probably still unidentified cases. So the real case fatality rate, if the right public health response is done, is likely less than 0.7. And so the good news is it may not be as bad as we feared if we do the right thing. What is the right thing? Well, the people who've probably done the best testing, I think the examples are the drive-through testing in South Korea and Germany, for example. The United States, unfortunately, we're behind on this. It'll probably be 1 to 2 weeks before we can get to here because unfortunately, we did not get enough testing kits out, and so there's a huge backlog of the ability to test. So this is not available right now, but hopefully will be available in the next 1 to 2 weeks so we can get a handle on how far things are being spread. So if our hope is correct and that the case fatality rate's in the 0.5% range, which is in the mild case expectations of the epidemiologists at the University of Nebraska Medical Center. The good news is the case fatality rate, although the numbers are high 600, it's still pretty low overall. I mean, it's worse than influenza, but it's not the Spanish flu of 1917-18. So if we get everything right, the most important thing to reassure everybody is that if we do things right, 99.5% of us will not die from coronavirus. And on top of that, healthy children and very young adults are very low risk. I've only heard of one potential fatality in somebody under 20, and so out of worldwide, that means your chances are extremely low. So it's the most important, of course, at least for me as a parent, I want to make sure my children are safe. And honestly, most young adults are also very safe as well. The flip side, though, 0.5% is still a lot of people, and then there are a lot of folks like the elderly, heart disease, smokers, where the case fatality rate could be in the 3 to 20%. And if we don't get it right, we'll be more likely to be like the Italian and Iranian responses, but we can avoid that, and there's still time. So what can you do? And credit goes to this from Carter Metro. I was forwarded a really great summary from the folks at the College of Public Health, James Lawler and Ali Khan, that we don't have treatment, but you know what? We can slow this down if we do four simple things. You'll hear the word NPI, or non-pharmaceutical interventions. If you're sick, stay home. If someone in your household is sick, stay home. Number three, close schools and daycare. And so, of course, some of you know that Lincoln Public Schools announced the closing of Lincoln's Public Schools next week. So we need to close these things down. That's why the state basketball tournament was limited with fans, NCAA. Nationwide, this is what's happening. So the good news is the country, although a little belatedly, is now getting on top of those things, and we're closing stuff down. Fourth is the social distancing. We require all of you in the community have to do this. And so it's important that you all listen and take this seriously. It doesn't mean you have to only be in your house, but you really need to keep a distance. The South Koreans and Germans are doing a good job at this. We can do the same. The model also quoted credit to Carter again on this, is that if you do it all right, what you'll see is that the difference in doing nothing is things could be horrible, but there are things, and if we do all these things together, the numbers could be far smaller. So it's really important that we do all these four things and we get them right. Also, another example, so at our clinics, remember that there are still other people sick, people with other diseases, people with diabetes and heart failure and sick kids. We do not want you exposing people if you have coronavirus, so don't go rushing off to your doctor's office. This is one of the clinics I work with. Dr. Tim Sullivan's office has this on the front of his door saying, stop, if you have these symptoms, go back to your caller and call us. We do not want you walking into the clinic or the emergency room exposing everybody there. So call ahead of time, unless you're severely ill, in which case maybe you should be calling the ambulance so that because one of the most important things is that you not spread it to everybody else. So stop, don't go rushing in. Make sure, and if in doubt, call your primary care doctor office. They can help you out. The most important thing, and I agree with this, was said to me by a friend of mine at LPS. This is a great visual. I tried to do one either. This is a much better version of it. Essentially, what's happening in Italy right now is they had such a wave it overwhelmed the healthcare system. So instead of a case fatality in 0.5%, it's much higher because they literally can't treat these people. People with are not being treated because they just don't have enough ventilators. If we slow it down and we do a good job, we will not overwhelm our healthcare system's capacity, and all the severely ill people could be treated. But it's essential for us to do our part and make sure that we adhere to the social distancing and closures and not push back against that. So again, our community public health response has already started. We close schools next week. This I can tell you it's probably likely this may continue. We're starting to cancel concerts, sporting events, limiting large meetings. It's up to you guys to home isolate when you feel sick, and give us more time to respond for those who are still severely ill. Do not overtax the health system with minimal concerns when we may have to be focusing on people who are more sick. So again, this will work. We know that it can. We have good examples of this working in South Korea and Germany already. So if we can slow it down, we can stop this from being as much as a crisis as it could be. So again, one more time, if you're sick, stay home. If someone in your household is sick, stay home. And then we'll be doing this as a community response number 3, but 4 is up to you. You need to start following directions and not ignore all this and act like it's not a real case. The good news is that sometimes people are sometimes their best when things are at their worst. A great example is our church council this last week had a discussion about what they could do to help out, actually. And their response was, with healthcare workers are overwhelmed, and because the schools are closed and they may be suffering from a lack of childcare, maybe our church's job is to try to fill the gap by offering free childcare to healthcare workers. That's the kind of response we need to have in our community, and that's the kind of thing that makes America great. So hopefully we'll all band together and do these things. The second thing is social isolation does not mean you can't go outside. If you're Lincoln's got a lot of options. Go ride the Mopac, walk around Holmes Lake, walk your dog. Just give people a 6-foot berth, and you should be fine. So being social isolation does not mean holing up in your house and hoarding stuff. We still need to get out. The weather's going to be nice, and hopefully that will actually help things. So hopefully this was helpful to you all. There is we need to take this seriously, but we also need to not panic. We can take charge of this, and we can do a good job in our community. And I think based on the governor's press conference today, it was a really good opportunity to see everybody talking about what could be done as a group. It was great to seeing people from education, healthcare, and the political spectrum finally dropping the partisanship and showing how we can work together as a state. So hopefully this is all helpful to you all.